Hey everybody, Chris Bailey here with Physical Therapy and Balance Centers. And what I'm going over today are talking about the disc issues in the low back. On the previous video I went over the anatomy of the low back in detail, and in this talk I'm just going to talk more brief description of the anatomy of the low back and the common presentations of disc issues. So when we're talking about disc issues in the lower back, we're talking about the discs in the bottom 5 bones of the lower back here, or vertebrae. And what these discs are like a jelly-filled donut. And when we move in certain directions, like bend forward with our spine like this, it puts pressure on the front of these discs, which if you think of them kind of like a bar of soap, would just push them backwards. So when people have this issue, a disc issue, most commonly what happens is that they start to have pain in through the low back through here, a sciatic type pain that shoots down into the leg, or even numbness or tingling into the foot and the leg. And what we see most commonly is it's worse when they sit forwards. When they sit forwards, basically this disc is in this area and through here, then they pinch this part here, and the disc goes backwards into the nerves back in this area like that. So the main treatments for this are to do some movements in which people go backwards. One of the most common ones we have people do are just standing extensions to go this direction here repeatedly. What that does is it starts to push those disc issues and the disc contents back to where they belong and through this area. And what we know is that if we can get somebody to where they have no or little pain in through this area for about 5 days, that the little structures back here that get injured start to heal up. And then what we're able to do is slowly introduce more forward bending movements, and that their back is ready for that at that time. What we don't want to see, or what you don't want to see when you go through different movements, and if it's with our active at home movements, you want to be cautious of this, is pain that gets worse and shooting down into your leg. It's called peripheralizing pain. You don't want that. What you want is the pain to come from your lower leg, back or butt area, back up to the middle of the back. Even if it's a little bit more intense, that's a good sign. So with these disc issues, you generally are better walking. You're generally better sitting up nice and straight. You'll want to use a low back support, so you stay up this direction here. That keeps the discs in a much better position. If you can, you might want to consider getting a standing desk, because we've had a number of folks at home now that have switched to that. They feel a lot better standing. It puts this disc in a much better position standing. So the things you'll want to be cautious of, if you have more weakness going through some of these movements at the active at home exercises, if you have worsening pain shooting down your legs, or if you start to notice numbness and tingling to a greater extent, just to let us know. Some other treatments that we do are we do some manual treatments to progress these discs in the right direction. Sometimes you just can't get enough pressure on your own to get this disc back where it belongs. So a few sessions of manual therapy will help to bring that around, and then you can get going with this active at home exercise series, or maybe even more specific exercises at home. So if you have any issues that sound familiar to this, please look at our active at home disc series exercises. It's about 7 or so of the best stretches and exercises for the low back. If you don't feel better after that, just give us a call. We'd like to take a look at it. There'd be some things we could help you with. Thank you.